We get to look at some couple of complications that might occur when you have what do they call it? A shoulder dislocation. So you know the shoulder is there, and around the shoulder you have a lot of blood vessels. You have a lot of nerves there. So sometimes you can have complications, and these complications are also affecting the structures. Okay, so you can have nerve injury, you can have rotator cuff tear, you can have uh, injuries to the blood vessels. Okay, that's complications of dislocations of the shoulder. So what we have is when a shoulder dislocation occurs, you are prone to have all these injuries and complications. Okay, especially when it's not managed properly or if the shoulder is unstable. So rotator cuff tear, we see that the rotator cuff muscles and tendons they stabilize the shoulder. So a dislocation can actually tear those tendons, especially in older patients. So this leads to weakness, pain, and difficulties lifting the arm up to the head. So it may require surgical repair if possible. Okay, this is just trying to show the blood vessels and the various nerves that are around the shoulder. So nerve injury, we said that is the axillary nerve is a nerve that is most commonly injured. Okay, most commonly injured. So symptoms include numbness over the side that the axillary nerve supply. Of course, the axillary nerve supply a lot of uh, the shoulder and the deltoid muscle. Usually recovers with time. And also the blood vessels could be injured, and the blood vessel that is likely to be injured is the axillary artery. It can be damaged, and this could actually reduce the blood supply, you know, to that part of the body. You understand? So signs include absent pulses, cold limbs, and also severe pain. Okay. So fracture dislocation. Sometimes dislocation is accompanied by fractures. Yes. So the humeral head can get dislocated, the glenoid bone can get dislocated, the clavicle can get dislocated. So why these complications matter is they can delay recovery and increase the risk of what you having a chronic instability. So vascular injuries are actually medical emergencies. Anything that has to do with your blood vessel getting injured is a medical emergency. So proper image, that's all those X-rays, CT, and MRI. It's very important. It's very essential, to treat the conditions.